Fiona Nixon leads a Think HQ strategy and insights team. She provides guidance and expertise in inclusive communications, planning, stakeholder engagement to clients, and across the agency. She currently provides executive oversight to the establishment and operation of the Department of Health and Aged Care Translation Service within Think HQ. And she is a passionate communications and sustainability leader. Her career spans in the private sector, consultancy, and the public sector, where she managed communications for social policy portfolios, including community development and multicultural affairs. For the past 7 years, she has served as a member of the Australia's Committee of Human Rights Watch. Thank you for being with us, Fiona, today, and I'll leave it to you.
It's fantastic to be here today to speak to so many of you about the project that Think HQ operates on behalf of the Department of Health and Aged Care. Think HQ was appointed about a year ago to run this program for the next 4 years. So Think HQ is a communications agency, as you probably gathered from my introduction. But we do have a big team that specialises in campaigns for multicultural communities and a language services team who provides the translation services for all of the work that we do. The team is accredited, certified under ISO 17100, which just means that we operate under very strict quality control processes. And we work with a growing network of about 250 NITE certified translators to provide this service. So let me tell you a bit about it. So the Australian government, as part of reforms, brought in this free translation service, and its real aim is to increase access for people to aged care services, which is a really vital and important thing to be doing as part of ongoing this bigger program of reforms that I know you're all aware of. So before I jump into the program, I just wanted to spend a couple of minutes talking about, why in-language materials are so important. So you can see there on the screen that, the census tells us that there are over 720,000 people from multicultural backgrounds who are aged over 65 in Australia at the moment. We're all waiting for the census to happen again next year to update that, and I'm sure that number is going to only increase. We know from the data too that the older people get, the less likely they are to have high levels of English proficiency. And so that obviously makes the availability of information and material in their own preferred language really important. Even for people who do have, levels of English proficiency, however, it is also important for in-language materials just for a comfort and that familiarity with the languages of people's origin. So I guess as aged care providers, it is really important that people in your care have information that they need delivered in a way that they also understand. The things, I guess, that table on the right just gives you a bit of a snapshot of the different language groups that are represented of people over 65. And you can obviously see that there are communities, large communities of people speaking, for example, Mandarin and Cantonese. But there are also smaller groups and emerging communities in Australia where there are really low levels of English proficiency. So the way that this program works is not only to provide materials in the languages that are very common, but also wanting to make sure that we can provide information for those small and emerging communities that really need it as well. And I can show you, I'll talk a little bit about the languages that we have been seeing over the past year. So I guess just to wrap this up, the translated materials are important because They help older people make informed choices that suit their needs and help them access the services that they are entitled to and need to live in a dignified manner as they age. But importantly, they also help families who might have higher English proficiency, but it actually helps them to communicate better with the people in their lives who they are potentially supporting into aged care or potentially supporting to navigate the aged care system. All right, so I might move now to the program itself. I'll start with the eligibility because there are a few different aspects to what's eligible for translation under this program. The first one is organisations. So the program is open to all organisations who are subsidised aged care providers, and they can be delivering care under a whole range of programs. You can see the list there at the moment. Or anyone who is providing any of those services can give us a call or access the service and talk to us about what they want to get translated. It is also available and eligible for peak bodies and also members of the Partners in Culturally Appropriate Care program, such as the Centre, who's hosting us today. And also, it is also open to care finders and encompass multicultural aged care connectors as well. So there is a broad range of organisations who can access the program. Then when we move to materials, and this is something that we do spend a lot of time talking to people who get in touch with us about. So going back to the real aim of the program to make sure that people have the information about the services that are available to them so that they can make choices is really what dictates the eligibility of materials. So the types of things that you can come to us with are things like welcome material, so information that talks to people about how your service operates and the kind of services that you offer, fact sheets and information about your services, so forms and templates such as registration forms, service agreement forms, and feedback forms. You can also come to us with signage, so wayfinding signage or other pieces of important signage. We also can translate audio and video messages, again, with content that helps people understand what's available to them or helps them to participate in the services. And we have done a couple of different audio translations in the past few months. And also importantly is disaster plan information. So that can be written, it can be posters, again, it can be signage, anything that helps people understand what kind of disaster plan you have in place in your service. On the flip side, there are some things that we can't translate under this program. So anything that has personal or individual content, such as letters or care plans or documents, are not eligible under the program. Neither is marketing materials, and this is the most commonly, the most common reason that we find we have to tell people that they're not eligible under the program. And really how we define this is information that is prepared, for the primary purpose of attracting new people into your services. So that can include things like special offers, things where you're talking about how you might be, what your differentiation is from others. Those kinds of materials we can't translate. The other one that we do see a little bit is material that is frequently changing. So again, because these things change quite a lot, they have been deemed ineligible. So that's like newsletters, like weekly menus or activity schedules, those kinds of materials. Having said that, we have translated an annual menu that a service developed for the whole year, sort of talking to people about the kinds of menus that they can expect. So we were able to translate that. And then the other category of materials that we can't have a look at is material that's created by the Department of Health and Aged Care. So we do have people bringing us information from the department asking for translation. And in that case, we've actually been talking to the department about the demand for those materials, and they have continued to build a library of translated materials that are being put on their website. So we've been saying to people, if there is a document that you need that's from the department that is not on the website, to let us know, and we then try and coordinate that with the department to have them do that. It is really important that you own the copyright to the materials that you're asking to be translated. And that really just means it's materials that you've actually developed. So they could either be new materials that you're developing specifically for people in your care who are from a multicultural background who need something in their own language. And it can also be existing materials that you have, but you're now wanting to translate into a language other than English. So if there is material within the documents that you provide that you haven't developed, unfortunately, we can't translate that. We have had instances where we've worked with a provider to just remove the material that is not theirs from a bigger document, and then we've progressed with the rest of that document. So just something to keep in mind. I might just spend a few minutes now just talking about how we work with providers. So the first step is obviously to make a request. We'll flash up the website at the end of this presentation, but the easiest thing to do is to go to the website and fill in the online form. It only takes a couple of minutes to fill in, or you can also give us a call. And there's a number. We have a team who are available Monday to Friday, 9 to 5, and they'll be able to talk to you about what you need. We will then get back to you within 48 hours. It's usually less, but within 48 hours, and talk to you in a little bit more detail about what the request is about. At this point, this conversation also helps us do the eligibility assessment against the things that I just showed you. And then we really need to get the brief right. And we are finding that this is a process that we do work with service providers to do. So obviously we need to gather information about the organisation, about who's going to benefit from the translations. We also work with you to get the right format for the files that we need, talk to you about the languages that you need things translated into, and then also importantly, what kind of formats the materials are going to be provided back to you, and what sort of format you need those in. So all of that really helps us get the brief right so that we can put the documents into translation. Our next step is then translation. So once we have it right, we brief a translator, and that is always a NAATI certified translator who works on the job. The translations are then checked by a second translator, and if it is a complex or technical document, we back translate that document into English just to make 100% sure that the translation is correct. Now, we do get asked quite a lot about turnaround times, and it's a very difficult question to give a single answer to. So it really does depend on the complexity of the material. So obviously a really big handbook of 50 pages in 12 languages is going to take us more time to get translated and checked and double-checked than a small brochure in sort of 5 or 6 languages. But what we do is once we get that brief right, we'll obviously let you know how long we think that's going to take. The other thing that can take a bit longer is if you're needing a particularly rare or emerging language included in that document, included in the translations, because for some languages there are obviously fewer translators available. But we make sure that the team always communicates with you about how that is progressing. So once we have the translations back and checked, then the next step is to produce them into the files that you need. So we have a team of designers who specialise in laying out all kinds of translated languages into documents, and they do that work and do the checking before we are able to send you a link to our platform to download the documents. We do provide a bit of time for you to check those and get back to us with any issues and make sure that we fix them up. And then we will also ask you for your feedback on the service at that point, at the end of it, once you've got all the documents, all materials, and are happy with them. There are a couple of things that I just wanted to highlight in terms of making the best use of this service. So obviously, it is quite common that there's a single document that you really need for some people in your care, and that is absolutely fine to come to us with a single document. But if you are able to, think about it a little bit more broadly and think about whether there are a suite of things that you might need over the coming period, it will make it much more efficient, particularly for you, because translation is probably not something that you do every day. So it would be a new process to work through. So it can be much easier to do it with a batch of things rather than just one single document. As part of the arrangement with the department, we will be asking you some questions about how many people are going to benefit, who are they, and we will talk to you about the languages and the needs for it. So having that, thinking a little bit about that up front is also a really good idea. We obviously have to get the right materials from you. We do encourage people, if they can, to give us editable and working files, but we understand this is not always possible, and we do recreate documents quite a lot of the time. But if you do, if your communications area or marketing area have editable files, that also speeds things up. And then lastly, I would say that if you're just thinking about what you might do or you're unsure about anything, please just feel free to give us a call. So if you've just got an idea, we can always talk you through it and provide some advice and help think about what might be best. There are certainly occasions where taking something from a written document into an audio file can be really, really beneficial for some people. So too can taking just some audio and creating some video content can also be really valuable. So there are lots of different ways of doing it, and our team are pretty expert in thinking through what the best solution is. So just to give you a sense, we've just been running this program for almost exactly a year, actually, today. So most commonly what we've been looking at and what people have been asking for are the handbooks. So we've done a lot of work on translating handbooks, a lot of work on translating forms and welcome information. We've also done a lot of sort of posters and that sort of disaster plan materials to help make sure that people understand those aspects of, particularly for residential aged care. Interestingly, we've also done a lot of communication cards. So there's simple phrases and things to help some of the frontline staff work with people who speak languages other than English. We've also done fact sheets and brochures, service agreements, and also pricing schedules. In terms of the languages, these are the top languages just by the number of requests that we've had for. And if you can remember back to that table at the beginning, you can see that there's quite a strong correlation with those languages and the size of some of the communities. Having said that, that's already quite a diverse group of languages, but we have also done quite a few translations in some more of the rarer languages where there is a need. So languages like Khmer, Tagalog, Tamil, Dari, and also Oromo. So it has been quite a broad spread of languages that have been requested. Interestingly enough, and probably quite due to some of the great work that's done by the Centre and other members of the PCAC network, more than half of people have said that they've come to this translation service as part of a plan to strengthen their culturally appropriate care across the organisation. And that's a really good sign of lots of work going on in this space. And about a quarter of people who've come to us have said that they have done so because of a word of mouth from colleagues or networks. So that might change in the next few months. It might be from, hearing about the service on a webinar. So that would be really good. So that gives you a bit of a snapshot. That is the phone number. You can also drop us an email on that email address. And as I said right at the beginning, the really easiest way to start off a conversation with us is just to visit that website, and you will see there is a form there to fill in to make a request. So I hope that's given you an overview of the service.
Fiona, you were saying as well that you're also doing your emerging languages. That's fantastic. So is that something that's coming up more and more, or you think compared to the, more established or other language groups, that's sort of a very small but important group?
So, Nikki, I would say the number of requests for the larger communities that are, the larger, more widely spread languages are certainly higher. However, I think in pretty much every request, and depending on the geographic location or the community in which the service is operating, we have seen people, being quite, aware of some of those emerging languages in their particular areas. So, which is really important because, those emerging languages often have older people who really don't have, who have really low English proficiency. And so thinking through that is obviously, really, really vital to them.
There's a question in the chat, and that is around, are you able to translate First Nation languages?
Thank you for that question. So this service and our contract doesn't cover First Nations languages. However, I know that the department has been working on a solution, and I think they are quite close to being able to include that in this service as well. So if you could just wait for that notification from them.
Thank you very much. It probably will be communicated, I'm assuming, to the Department of Health and Aged Care's newsletter.
Yes.
Now, the next question, we have the questions are coming in. That's great, from Thomas. Thomas is asking, what is the turnaround time of, say, a welcome document explaining the service and the client's rights and responsibilities into the top 16 languages?
I don't want to make promises that we can't keep, obviously, but look, for top languages, so let's say it's a document of 5 or 6 pages that is approximately, let's say 1,000 words. The really common languages, the translations we can turn around within a week. What complicates it is if the documents have more technical language that we need to have also back translated into English and then checked again. We have been developing a glossary of terms for aged care that we share with our translator network to make some of that technical language easier and quicker and more accurate to translate. But the technicality of the language can create longer timelines, but also the rarer language where it is more difficult to find 2 or 3 translators to work on those projects. But once we kind of get a request and we understand what the scope and languages are, we can provide a pretty accurate timeline to you at that point. It's very difficult to generalize, although I understand that people like to know.
We have a comment from Christine, and maybe that's sort of more an advocacy point, but could notifications through MyHK eventually be sent out in languages of the person, which is like a really great point if MyHK, sort of would have the capacity to do that. I really like that point. Maybe something, Fiona, we can try to I don't know, raise with the department at some stage, because it's something that would really make things so much easier if that, integration on MyHK would be in the person's first or preferred language. Yeah.
Wouldn't it? Would be very, very powerful.
We have another question. Do translated forms that require completion have both language English and the translated language on them for the benefit of the person receiving the completed document and may need to enter information in some way? So it's basically because care staff might most of them speak probably English and the client might speak another language. So how does that work? What do you recommend, or what's the norm, or is there no rule around that?
This is a really good question, and we've had a number of discussions about this. So there are some languages where that is easier to do if a service particularly would like it. However, there are some languages, particularly right to left languages, where it's almost impossible to create a form that is both usable for the person, for example, speaking Arabic to use it, and also for somebody trying to use it in English. I guess the general recommendation is to have the form in one language and to be able to, I guess, cross-reference and have it laid out in a very similar way so people can use them together. But it can be quite complex. It also depends on the complexity of the form.
We have another question from Debbie. For an existing document with graphics, do you just apply the translation within this doc, or do you need to create a whole new one, which the service will have to recreate graphics after this? This is a very sort of technical formatting thing. Fiona, what would you say on that one?
We have an in-house design team that I mentioned. So the idea is that whatever the format of the document is that you give us with graphics or photographs, the service will provide you with the translated ones looking exactly the same. So we do a lot of work sometimes we do, if it's a flowchart or something, we will translate that and recreate it in the translated language. But generally, whatever you provide us in English, you receive back in the languages that you request in the format so that it's immediately usable. That's our general rule. In getting that brief right, during that process of talking to you about the brief and the format, that's where we would have the conversation about whether you've got graphics ready for us to work with or whether we're going to recreate them so that we get that all sorted at that point.
Another question. We know that there's more take-up of that service in Victoria and New South Wales. Why do you think that's the case? And what can we do to sort of, promote the project across other states? And the second question I have is around regional uptake as well. Are services in regional areas using the project?
To your first question, it's difficult to know why Victoria and New South Wales. I mean, there are obviously larger populations, but it's not to say that should dictate usage of the service. We have been working with the department to reach out to, peak bodies and others in all of the states to spread the word. And someone's been doing a good job in WA because we've had quite a few requests just recently from WA, which is great. But I think there is probably more effort to be done to help activate the networks in regional areas. We have certainly had quite a few requests from big regional centres, but I think the smaller the towns and the more remote you get, the fewer requests we've been receiving. So anything that I guess networks of people or services can do to help spread the word, the better, because it is open to everybody.
I wanted to ask you one more thing, Fiona. So with the translations, when people ask or undertake a translation project, is it usually just for one language, or they take a batch of 10 languages? Is there sort of any sort of, tendency or how it works, or is it really varies very much amongst providers?
It really does vary amongst providers. Obviously, there are some providers who are working within specific communities, so they tend to just request the language for the community that they work in. Most requests, though, have at least 5 languages. And in many of those cases, there's been a conversation about it. All the service has already done the analysis of who is under their care and have a list of languages that they know are needed for their service. For some of the other peak bodies, though, we've done up to 40 languages for some materials. So it has really varied depending on the need.
We have a kind comment from Sanetta. I want to share my experience of using this service. It was really helpful and walked us through the process step by step. Thanks. So you made someone very happy there.
Thank you. That's a lovely, very kind endorsement.
We have a question from Taran. How long is the service available and is it time limited? So that's probably around the funding of the service going to the future.
As far as we know, it is ongoing for the next 3 years. There has not been any indication that is the end of it. So not being privy to those conversations, that's probably the most definitive answer I can provide.
Is there any final comment you would like to make before we close off the Q&A?
Look, I guess I would just say that it is quite an extraordinary program, and while it does take a little bit of time, and I know everyone in the aged care sector is very busy with a lot of different priorities, this providing care for each and every person under your care is vital, and with a little bit of an investment of time, we can really help you with those materials free of cost. So I'd really encourage you to access it, or even just give us a call to talk about what your needs might be.
We really appreciate your participation, your comments, and we're looking forward to seeing you at the next webinar. Thank you very much.